Hi everyone, I'm Dr. Funke Afolabi Brown. Welcome to part two of our sleep apnea in kids series. So, part one, if you didn't watch it, definitely click the link that's below to take you there. We talked about what obstructive sleep apnea is in children. We talked about the different symptoms and how you, as a parent, need to be the detective to figure out, is this snoring that my child is having related to sleep apnea, or is it something else that's benign? And so in this particular video, we're going to be shedding light into what you get done when it comes to testing for sleep apnea, right? Because what you're telling me when you come to see me in practice to say, oh, my child snores and his mouth smells and he's waking up frequently at night and has behavioral issues in school and learning needs, those are clues for me to say, wow, okay, this might be sleep apnea. But not every child that snores has sleep apnea, right? Not every child that has allergies has sleep apnea. Not every child that has behavioral issues has sleep apnea. So while this is a very serious condition, up to about 6% of children have obstructive sleep apnea. So it's relatively common, but more than 30% of children worldwide have snoring, right? So are we going to go and do surgery and take out tonsils and adenoids from every child with snoring? Absolutely not. So this is where testing really matters. And this is where it's important that you find a physician, a provider that will listen to you, listen to what you have to say, listen, lean in and make you feel heard regarding what is going on with your child. And that's what we do at the Restful Sleep Please, because we take time to really make sure that you are complaining about that your child has, what's going on, is really a sleep issue that needs to be addressed versus something else. So we help you be that detective. And if I didn't mention it already, I would love it. Can you do me a favor and just subscribe to this channel? Because this way I get the word out, because this is really important information that I want to make sure that as many people as possible hear about this. Actually, this topic on sleep apnea in children, it's pretty personal. I had a very, very close family friend whose child had severe sleep apnea and would turn blue because they had pauses in breathing during sleep. So very, very scary. And while most cases are not that extreme, it's definitely something that we want to lean in, pay attention to, and address as soon as possible. Because if we don't treat it, then we get a lot of chronic, symptoms, headaches, poor health, frequent colds, behavior issues in school, learning problems, obesity. There's so many things that could go wrong if sleep apnea is not treated in children. And remember, your child's brain is developing very, very rapidly within the first few years of life. So if you're getting oxygen cut off while they're sleeping, that's going to affect their brain growth, right? We don't want that to happen, right? So we've talked about recognizing the symptoms and not just sitting on it and just wishing it will go away or ignoring it. Absolutely not. Once you recognize that your child has symptoms, the next step is to make sure you are seen. So, what does that look like? There are three ways you could do that typically. Of course, you want to speak to your pediatrician, your child's pediatrician, to let them know what's going on. And then usually they will refer you for what we call a sleep study. Sometimes they could order the sleep study directly where you go to a sleep lab, or they'll send you to a sleep doctor like myself, and we'll talk through what's going on. We'll talk through what does this look like. We'll talk through, okay, over the next few months, what's life going to look like if we do have a diagnosis of sleep apnea, if we don't, right? So we get that very comprehensive feel. And sometimes they might be sent to an ear, nose, and throat doctor. Remember, I told you that the most common cause of sleep apnea in children is the big tonsils and adenoids. So our ear, nose, and throat colleagues, we call them ENT, usually are responsible for taking those tissues out to open up the airway. So they might tell you they might send you there. Okay, now you've made that choice, you've talked to your pediatrician, they're like, we got to test this. This looks like it's actually something that we need to address. And then what are the tests? How do we diagnose sleep apnea? The first is the history. And we've talked about that: snoring, difficulty breathing, daytime issues, all that stuff, right? The second is what we call an examination. So, a physical exam is really just taking a look at your child, in addition to the history, looking at their face, looking at their anatomy, looking inside their throat to say, are there big tonsils in the way? What does their tongue look like? Does it look like their tongue might be falling back to the back of their throat and blocking it? Are they overweight, right? So again, we're we're really doing that detective work to figure out what's going on. And then the test we really do is what you call a sleep test. There are many words for it. It's called a sleep study. It's called a polysomnogram, right? Polysomnogram means many, somnogram, sleep. So many channels for sleep. So this test is a very comprehensive test that has multiple channel recording of sleep for your child. So the polysomnogram is usually done in what we call a sleep lab, a sleep laboratory, or a sleep center. So your child will come to that sleep lab and get this really comprehensive testing. None of these tests are invasive. Many channels are recorded in terms of breathing, and I'll start from the top. First, you have what you call an EEG. So those are stickers that are put on the surface of your child's scalp to monitor their sleep. Because when your child is asleep, they're going through different stages of sleep. So we got to figure out, is your child asleep? Are they awake? So that just helps us know. Then we have other channels that will actually measure airflow and air pressure. Because remember when I talked about sleep apnea, pauses in breathing. So that will help us see, is there a pause? Is the pause a partial pause, what we call a hypopnea? Is it a complete pause, which we call an apnea? So we are looking at all that data, right? We also have a snore channel or a microphone because we want to hear, is there snoring? Is the snoring loud? Is the snoring at certain positions? That's all just really important information. Okay, so after that, we now have what we call belts. We call them RIP belts. What are those? Those are just literally bands that are it's across your child's chest and their stomach, and we're watching their breathing. Because when children have sleep apnea, they have struggles with breathing because they're fighting to breathe against that upper airway obstruction. So this really helps us to see, is there increased work of breathing? And this is how we typically can decide if this is an obstructive apnea or a central apnea. I'm going to just digress a little bit. If it's a central apnea, that means that the brain didn't tell the muscles, the breathing muscles to move, right? So you don't get any chest wall movement at all, and you get a pause in breathing. So that's how we tell, but that's a little technical. Now we have other channels that we measure during the polysomnogram. We measure your oxygen level. So usually they'll put a sticker on the finger to measure oxygen, the pulse ox. We measure carbon dioxide. Remember, I said sometimes the body will hold on to carbon dioxide if you're having sleep apnea. And then we measure movement, right? Is your child really restless? If they are, how frequently are they moving? So you can see this is a really comprehensive test. I mean, it sounds intimidating, but it gives us exactly the information we need. Because if your child has sleep apnea, we want to treat it. If they don't have sleep apnea, we want to know, right? So it's very extensive. You'll come, the child will come spend the night. They'll come with their favorite PJs, their stuffed animals. They're actually videos, YouTube videos and things, which I will include in the comment section that you can watch to even learn about this experience. I actually did one myself, and so I'll include that as well. And so you then can, you'll come in, you'll spend the night with your child as well. So usually it's in a room, your child will have their bed, you will have your little, cot, whatever, to spend the night. And then once the test is done, you get to go home. You get to go home. The results are then interpreted by a sleep physician like myself. And then we can call you and then talk through what is going on. Is there sleep apnea? We use what we call an apnea hypopnea index. So that's an index to decide the severity. And there are three main types of severity. There's mild sleep apnea, which, if it's very mild, sometimes we just observe, we don't really do anything. If there's moderate sleep apnea, then we really need to start to say, okay, I think we need to have some treatment options. And then if there's severe sleep apnea, then, absolutely we need to make sure that is addressed as soon as possible. So we take the number, the apnea index, and we take the history, which is what your child is complaining about, and then we come up with a treatment plan that is best for you. And that's what we'll talk about in the next video. Okay. Now, apart from the polysomnogram, there's also another test that we can use. It's a home sleep apnea test. So it's more of a portable sleep study. Now, sometimes, especially with children with a lot of sensory issues, it's a struggle to get them to wear all those wires and things. Again, they're not painful, they're just a little bit uncomfortable. And so, fortunately, there are some home sleep apnea tests. Now, I would say that there's a caveat. The body that really authorizes the sleep, that makes decisions on how we take care of children with sleep issues, for example, the American Academy of Sleep Medicine has not yet approved that home sleep apnea tests be the gold standard for diagnosing sleep apnea. They want us to do the polysomnogram, which makes sense. It's fair. The home sleep apnea test is great for comfort for your child. They could do it in their own home, but there are not as many channels, very few. In fact, some of them don't have any EEG leads. So you may not necessarily be able to gauge exactly what stage of sleep they're in. Some of them don't have those rip belts. So sometimes the index that you're getting may be less than what the child actually has. But the benefit is at least it's a good way to get a sense of what's going on. And so you also have to discuss, with whoever is ordering it, how you want to use that test. Do you want to use the home sleep test just as a screen? Maybe, for instance, the in-lab test is going to take months, and you need an idea of where things are. And so you want to decide, like, if it's completely normal, maybe there's no sleep apnea, or if it's very mild, then maybe we need to explore a little bit better. So it's important to think of what the goal is for doing a home sleep apnea test, and also know that most times your insurance company may push back and they may not approve it. So these are some conversations I have with my patients, because especially if you have a teenager, they're like, I don't want to come sleep in the sleep lab. And so this is always an option that I provide, but I tell you, it is not as accurate, not yet. There's a lot of research going on to help us figure out how to use it in a way that's safe, how to use it in a way that can inform the decisions we make in taking care of your child. So home sleep apnea test may be an option. Polysomnograph is the gold standard, and there are ways that you can get your child ready to get the test. It's also important that if you're going to take your child to get that home sleep to get a polysomnogram, that it is done in what we call an accredited sleep lab, because not all sleep labs feel comfortable with taking care of children. So it's really important that you connect with someone who will make sure that you get that sleep study done in a place where they feel comfortable taking care of children. Okay, so that was a lot, but those are the two broad ways by which we make a diagnosis of sleep apnea. Sometimes we'll do video recording. I always encourage that. Like, if you have your child, you're like, I don't know, is this snoring? Is this wheezing? You can do an audio recording on your phone. You can send that over, and then you and your doctor can talk through and say, oh, no, it's not, it's a cold, or it's not snoring. Oh, yes, it is. In some situations, people will buy, from over the counter, they'll buy like a pulse ox so they can check for their child. That's definitely not as reliable. So I would be cautious about using tools like that. Okay, so it's been a lot I've thrown at you, but you can take it because it's so important that you know exactly what you need to do. So now you have a child who's snoring, you're concerned they have sleep apnea. We're at the point now where we're like, okay, we got to get it tested. These are the tests that are available, nothing invasive. It will help us grade the severity of sleep apnea your child has. It will help us know, should we do surgery? Should we do medicine? Should we do weight loss? Should we use oral appliances? There's so many options available. And also, it would also help with monitoring, so that after intervention, for instance, we can then say, did it help? Did it not? We can repeat a sleep study because we have a baseline. So this has been amazing. I've enjoyed chatting with you today. Let me know in the comments if you have any questions. And also, I would love it if you subscribe to this channel, because this is how I get the word out there. So subscribe and help me get this word out, right? Because it really helps our ratings. And then finally, if you are in the area of New Jersey, Pennsylvania, California, I want you to schedule a call with us at the Restful Sleep Place. If you have a child with any sleep issues, we treat behavioral, medical, and everything in between that's affecting your child's sleep and also disrupting your sleep. And it's a telemedicine practice. You will feel seen, you will feel heard, your complaints, your worries will be addressed, and we will help your family sleep better by working with you, right? So I would love to see you there. The website is therestfulsleepplace.com, and our phone number is 215-607-8297. This has been amazing. I just want to encourage you to continue to prioritize sleep as a critical aspect of you and your child's wellness. We're here to cheer you on all the way. And until next time, I hope you rest well.